You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
In this episode of MaternalRx, we're bringing the data to light about the latest claims about the adverse reactions in pregnant women caused by acetaminophen, the active ingredient in Tylenol. Our two expert hosts bring their specialties together in this Pharmacy Podcast Network exclusive podcast episode.
Hi there. Welcome to the MaternalRx podcast on the Pharmacy Podcast Network. This series is to empower pharmacists to help turn around maternal morbidity and mortality rates, which now constitute a public health crisis. Pregnant women often fall into this hole of healthcare, especially antepartum care, and pharmacists are perfectly aligned to fill that gap. We are the most accessible and trusted healthcare providers. But we want to make sure the information that we are sharing is accurate and true. So today I am digging deep into a hot topic in our news, and that is acetamin safe in pregnancy? I'm your host, Dr. Danielle Plummer, pharmacist and antepartum doula, and really excited today to have a co-host. Mark, I'm going to let you jump on. You are a pain specialist, and give us a little background about yourself.
Thank you very much, Danielle. And well, those of you that know me also on the Pharmacy Podcast Network from the Pain Pod, here I'm Dr. Mark Pain Guy Garofoli. We'll stick with Mark for the rest of this, of course, but pleasure to be here. I hope we have some cross audience amongst the way, but boy, can we get a hotter topic today. Is that even possible, Danielle?
I don't think it's possible. This is when our president comes out and says something, and again, it has to do with women's health and safety. Let's dig deep and find out what's going on with it.
Absolutely. And, you know, we all have to listen. When leaders speak, we've got to listen and hear, and then we've got to do our due diligence in the background as well, too. So happy to be here today joining you, in this really pivotal topic in the big picture.
I do want to say one thing before we get started. I have a couple disclaimers. This podcast is for education only. Please consult your healthcare providers for medical advice. And everything I share on this podcast is strictly just my own experience and education and not a reflection of any company for where I work. So now that that's out of the way, let's dive deep into this hot topic, acetaminophen, better known as Tylenol. Is it safe in pregnancy? And I have a few key points that we're going to jump into, but let's talk about this word correlation and how that differs from causation. Would you like to get started on that, Mark?
Ooh, that's a big one and often missed. One of my favorite scary pictures in the Halloween sense is a jack-o'-lantern that states causation from correlation. That, my friend, is scary stuff. There's an appreciable difference. It's astronomical, actually. So, causation is saying B happens because of A. It is substantiated. It is concrete. Correlation is saying, well, when you have A around, B might happen. There's a lot of correlation out there. I've seen things like, the temperature rises in the summer, so ice cream sales go up, and then crime goes up too. Are they related? Who knows? Maybe they could be correlated, but causation, that's a whole other thing. That requires more thought, more proof. It requires proof. I don't know your take on it, but that's, a big difference there of causation is saying this happens directly and a lot of times exclusively because of the offending situation overall.
Absolutely. And in the medical world and in research, we call it confounders. So confounding describes a situation where the observed relationship between an exposure, which is your independent variable, and an outcome, which is your dependent variable, is distorted by a third external variable, like I said, known as a confounder. And this was the case with Zofran or ondansetron as well. And now we are here with another, what we thought was a very benign medication. You have pain. Tylenol for decades has been known as like the one pain medication that we can take during pregnancy. So like I said, it's been the go-to pain reliever for millions of pregnant women worldwide. But this recent media coverage has like stirred fear about possible links to autism and ADHD. What does the evidence really say?
Oh, there's a lot of evidence out there, and that's the thing. That's quite frankly, that's what kept me up till 2 a.m. every night of the last week and a half. Um, Point blank, one of the first questions for anybody is, did you read the study? And I mean that to, a lot of folks. Not everyone has to read everything, by the way. But, when taking advice from folks, it's really coming up short if one, not reading the studies, but then also scrutinizing the studies. Now, in the announcement recently here, the review article of the day, if not decade at this point, it was a review article. But that's going to innately be going over other studies, other review articles, other case studies, other information from elsewhere. So it's really not just enough to read the review article, but you want to really dive into all of the other studies as well too. And rest assured, folks, as you're listening here today, we've got you covered. Okay, lots of time goes into reading all of those, but it's incredibly important overall because we as pharmacists and quite frankly all healthcare professionals, we can't pontificate. We can have our personal and professional opinions, but they need to be founded on the science in the background. And, saying science, it seems to have evolved into, well, the reality that there's 1 to 3 studies for every point of view on this planet. But what are the studies? What's concrete about them? And that's where we really get we dive into the fog oftentimes. And here we are today talking about paracetamol. Me and the rest of the planet, we call it paracetamol, but us Americans, we tend to call it acetaminophen, by the way.
Yes.
Tomato, all the same bucket. But there's a lot to unpackage, as you were alluding to, when it comes to the review article itself, and all of them contained within in the big picture, really.
Absolutely. And one of the ones that's being talked about the most is this study from Sweden. It was a nationwide sibling control cohort published in JAMA in 2024. 2.48 million children were looked at. And what I learned about the countries that have socialized medicine, like those in Scandinavia, they have great records. So it's easy to look back, right? To do these studies and see. But what they found was that when they did the control analysis with the siblings, there actually was not an increased risk, unlike what the original headline had led people to believe. And it was a respective review article. So looking at like millions of babies born from 95 to 2019 with a follow-up in 2021, that with that confounder looked at, there was no increased risks. We have some other studies too. 2021 European Journal of Epidemiology, looking at 74,000 children. Again, when you dive deep into what was going on with the studies and look at the confounders, not diagnosis, not the causation. 2019 JAMA Psychiatry biomarker study, looking at cord plasma of 1,000 newborns. So these are all studies that were cited in the statement. Did you want to jump on feedback with any of those, or do you want to go on? And what I want everyone to understand coming out of this is, what do the authorities say?
Right. And it's really important to unpackage things. So I hope folks can appreciate that here of, what you were just sharing there is a very good, deep to, okay, what did the other studies say? Who the Swedes, I tell you. They had 2.5 million babies people, adults eventually, actually, but 2.5 million people in that study, okay? At some point, at all points, we have to respect statistical power, okay? When you have 2.5 million humans, that's pretty impressive, okay? Before you even dive into the statistics. And some other studies that maybe have some non-congruent information do not have that many zeros. So that's an important thing to keep in mind as well, too. I think it was within headlines, it was covered as like what conclusions were. Well, really important to think about what did the study authors say as well. That 2024, it was published in JAMA, the Swedish study overall, that review. The authors, it's like when you're doing a presentation, you're never supposed to read the slide, but for the sake of how important it is, the author's verbatim statement was acetaminophen use during pregnancy was not associated with children's risk of autism, ADHD, or intellectual disability in sibling control analysis. And that last part, that's the end of the quote. That last part is what you were just alluding to and really hopefully trying to emphasize there of when you account for something else pretty profound like sibling control, familial concerns, all of a sudden, poof, away goes the risk. And that's really, really important on top of the about just short of 2.5 million humans being involved in that study. Otherwise, when some of those studies that were included in this review, the review of the hour here, I believe you mentioned the 2019 JAMA Psych, it was a biomarker study. So, there you're talking about looking for, a substance, acetaminophen, or even metabolites, within within the cord plasma of newborns. They had about 1,000, I believe. So when somebody hears 1,000, you think big. It's like, lisinopril 10 compared to metformin 500 milligrams. Depends on who's reading that, right?
Yes.
1,000 newborns sounds big, but pales in comparison to 2.5 million, right? So it's relative to what ballpark we're in here. And when you're looking at, that's not necessarily outcomes. You mentioned the other study from 2021, European Journal of Epidemiology. They were talking about symptoms of autism and or ADHD. That's different than a diagnosis. It leads to it, but it is not all encompassing along the way. So, there's these concerns within some of the studies in the big picture. Really, though, I think to your original question there is what about this review article? Everybody keeps saying study, which yes, but review, the one of the hour, the one of the decade, as far as what was utilized for the announcements last week. There's a lot to unpackage with that one as well. Would you agree there that there's just a lot going on there? We touched on some of the studies included in it, but even within in and of itself, there's concerns along the way.
Absolutely.
And it's, one of the first questions I had, I had many questions, and I'm not going to say I hope that everyone else had them, but I know you did. And by the way, the response of healthcare professionals, both individually and as professional organizations, wow, clap, amazing. There was a lot of purple on social media feeds, the ACOG responses, a lot of sharing of that, and folks stood up. And it wasn't really a question of mine of whether folks would, but it was when, and it was pretty quick and pretty profound. So a lot is meant to be said by that. But really, one of the bigger questions with the review article of the hour is, well, why? There's what, I don't know, 10,000 medicines out there, pretty much more than that, right? But let's just go with that. Why paracetamol, acetaminophen, Tylenol? Why that one? That's a big question there. And, this isn't necessarily investigative reporting. There's information that's been out there now. It's substantiated. There's references for it. But one of the first things is, look at authors. Okay, anything going on there? Well, the corresponding author, also the dean of the Harvard School of Public Health, received just over $150,000 in expert witness fees in testifying that to the claim of I hesitate even saying it, but to the claim of acetaminophen, causing autism overall. In a 2023, I believe it was, hundreds of court cases put into one multi-district litigation, MDL. We've seen this in the opioid crisis, but don't get me going there, folks. The same thing where it's all the cases put together, and then one judge said, you know what, there's no evidence, so he tossed the case out, the case being hundreds of cases, hundreds of thousands of dollars, by the way.
And Mark, can I pause you there for a moment?
Yeah.
Because is this a normal fee for an expert witness? I know pharmacists, at least in the US, a lot of them are looking for side jobs or other things. We have this amazing knowledge. What else can we do with it? And a lot of them want to become expert witnesses. But $150,000? That does seem excessive, right?
That's up there for salary even.
Yes.
And by the way, to what you're saying there too, expert witnesses within the healthcare field deserve and earn a very appreciable compensation along the way. It's not so much the amount, although it's up there in this case. It's more so that, the answer was the judge saying there's no evidence, and then all of a sudden an author publishes a review article that is stating to be the evidence of it, but includes studies that say the contrary. That's where it's really at. So
absolutely. And I want to bring up a point that every pharmacy student is trained on, every pharmacist counsels on. What is the dose, the duration? What is the reason you're taking the medications? Everything we ingest, whether it's a medication or a supplement or even just food, could be just a vegetable for that matter. There's risk versus benefit. And there's nothing that's black and white statement saying this is safe or this is not safe. And that was missed in the discussion of this publication. The authors of that review did go on to say, while there is no causation found, we recommend always using the lowest effective dose for the shortest duration of time under the medical guidance and supervision tailored to that individual. Was that message conveyed to the American public? I did not see it, right?
That's the easiest question anybody's going to hear today, right? And you bring up a very good point there of, tempering the information, providing it succinctly yet comprehensively. And, I appreciate you having me on, as a co-host here for this podcast, but by golly, I wish I was one of the authors to be able to just say that of, it's different than what was conveyed overall. And that's very, very important and appreciable along the way. We have to keep that in mind in the big picture. One of the other big things I think you just unraveled there was that, all medications have baggage. We call it safety and efficacy. We have, efficacy intended effects and then safety involving things like even side effects. It's a philosophical statement, really. The substance itself, the chemical, the medication is like, here I am, hear me roar, I'm going to do these things. We call them side effects and whatnot, but all medicines have that. It is our charge as healthcare professionals, particularly, even licensed pharmacists, medication experts, of course, to dive deeper into that of what's anticipated. And I've heard lots of reports, or not reports, but reminders from folks of like, oh, well, there's about 50,000 people that end up in the ER from acetaminophen each year.
Yes.
Heck, I've done studies and posters even including that information. I have my own story that was published in an APHA book talking about a patient that had overdosed on acetaminophen. The point being is that those situations, that involves taking a lot more of the medicine, not the lowest needed dose for the shortest duration overall to take care of a situation such as a pregnant patient with a fever. Think about that, right? I know what podcast we're on here. A pregnant patient with a fever.
Yes.
That is a very concerning situation. It needs to be mitigated, right? That's one of the biggest questions of the day here, really.
Fever, absolutely. Family history of autism. 10, I read online, did not fact check this one, but tend to have more pain in pregnancy. There's so many other things that can cause pain in pregnancy. Mark, if somebody is afraid to take Tylenol for a day within the approved dosage for pain, what other options do we have?
Well, there's a creek and we have a canoe and we might not have a paddle.
And that's my point exactly, right?
Yeah,
Let's
exactly.
remove the fear of taking, you are the pain expert. And if we don't, off the top of our head, come out and say, well, you could take this, that, what does that leave us? Yes, there are maybe some topicals or some other things, but as far as we know, no NSAIDs or ibuprofen, or diclofenac or anything in that category, let's stay away from those. And even aspirin at low dose is the best thing you can do to prevent preeclampsia, but at high doses can cause problems and formations while the baby's being developed. So Tylenol is that one that has been used for decades. I want to bring up another point that within the pharmacist community, the ones that are saying, what they're digging deep, saying what could possibly cause this, and they're looking at the relationship of higher doses of Tylenol being metabolized through the liver, as you mentioned. We do have these patients coming into the emergency room and in the hospital because of the liver effects. And that's why when I was in pharmacy school, they said 3,000 max a day milligrams, not 4,000. Now I see on a short term, 4,000 is fine. But they say it has to do with the glutathione from the liver. But again, we're talking dose dependent here and the condition of that patient's liver. So keep those in mind before you refuse to take Tylenol because of a fever or acute pain during pregnancy.
Absolutely. I've heard, actually, we've all heard a lot of concerning things over the last little bit of time here on the chronological timeline of our planet here. But, some of the things are, this is getting extrapolated into folks being, and I mean
Yes.
anyone being
Yes.
concerned with the concept of taking acetaminophen, or as the rest of the world calls it, paracetamol,
Yes.
for your common ailments of pain, fever as well. And
Yes.
that is a huge concern. Because that is, there's so many misapplications of the studies within this review study of the hour, and in of itself as well, but minimally involved looking at, what medication was utilized by a pregnant mother. So to extrapolate that beyond that situation to just saying anyone with, let's say a patient in pain, of any patient, any pain, that we have to watch for. Okay. And that's really important thing to keep in mind overall of, like, one, do the due diligence with these studies, but then let's not extrapolate further. That just becomes a web of concern overall. I don't know if you've heard of anyone with that, and again, they will be anecdotally anyway, but I've already talked with healthcare professionals that were hearing that, beat from the street, I guess, of, okay, we need to nip this right out of the gate here. Hopefully in efforts like this, quite frankly, just going into what's at stake here, what's at hand. So many folks have heard me even talk about, when you get into the pain management realm, it's all about having a diverse treatment plan. There's lots of options overall, and just going over everything, with each individual patient along the way. One of the things that comes up though is, and I think you may have been jumping here, but the idea of, well, how do we trust and who do we trust? I mean, by golly, us pharmacists and a lot of healthcare professionals, we're always at the top there, with near the top, around the top, for being a trusted profession. But that's saying profession, and individuals here and there, can be deviating from that. So one of the things I usually, and I certainly welcome your thoughts here, is just saying, not just blind trust. Okay. We have the proverbial line of, like, oh, we'll talk to your healthcare provider or pick a specific one. But you don't know, like, what's their resources, what's their bias, what's their opinions. Any individual, present self included, by the way, is going to have that as a concern overall. It's where are you getting your information from? What studies, what professional groups, panels of experts that have been, through the rigor to even be in the room where it happens in the first place, right? I'd love anyone's thoughts really on that, of, like, how do we go forward? This trust thing is incredibly important overall.
Mark, you brought up such an important point. Right, actually, not even right when it happened, but proactively. This is one of the only times I have ever seen every health authority say the same statement. And you can look up any one of these: Society of Maternal and Fetal Medicine Specialists, American Pharmacists Association, the FDA, American College of Obstetricians and Gynecologists, the World Health Organization, the NHS over in the UK. In Canada, they have SOGC. And ultimately, the March of Dimes, literally like the OG of medication safety in pregnancy, right?
Right.
Every single one of these health authorities says there's no evidence that Tylenol is unsafe at the recommended dosage. No direct link. It remains appropriate when indicated. Use the lowest effective dose. Evidence is inconsistent. Avoid over-interpretation from the World Health Organization. Stick with our evidence-based practice. NHS saying acetamin is the first choice painkiller in pregnancy. Every single one of these. And then March of Dimes, you can look online and see their announcement specific to the White House's announcement linking acetaminophen to autism. Have you ever seen any public statement where every leading healthcare organization is on the same page?
Not only is my answer no, and I mean it in the nicest way possible, but not as quickly either. I mean, obviously, if
Right,
the answer is no, it's not as quickly as well, but
right.
still, like that's with emphasis there. We're talking within 24 hours at everything everywhere, right? Um, it's incredible and needs to be appreciated as well as you articulated there. It's impressive. So,
Very impressive. And I'd like to add a quote I read from a colleague on LinkedIn, Shannon Fountain, about autism. Autism is not my specialty. So I wanted to learn more about it. And as I mentioned, I read one of the things is that pregnant women who have autism may experience more pain, leading again confounders. But Shannon said autism is not a disease, and there's no evidence that acetaminophen causes it. Despite extensive research, no single etiological factor has been identified. Instead, autism spectrum disorder is understood to be a multifactorial neurodevelopmental condition influenced by a complex interplay of genetic, epigenetic, and environmental factors, contributors, the mechanisms of which are not fully understood. So, how non-licensed people in our government can come out and say that one medication like acetaminophen, Tylenol, paracetamol, can cause this spectrum or increase risk of your spectrum is just mind blowing to me. And if anyone can answer that question, please reach out to us. I would love to know.
absolutely. And I'd even want to double down on that of the incredible concern, yes, but on the compassionate side, can you imagine, and I'm not there, but can you imagine being a pregnant mother right now who happens to spike a fever?
Mm.
I hope that stops some folks in their tracks right now, quite frankly. I've already been. Or, perhaps a patient, with autism or a parent thereof.
Mm.
What's going through everyone else's minds right now, right? Like we as healthcare professionals, we stand up, we substantiate the evidence and translate it for everybody to what is the bottom line. That's what we're here for in the big picture, and we've done that. But in compassionately in the background, we also have to appreciate what folks are going through and trying to navigate together. And lo and behold, here we are again as healthcare professionals, as pharmacists, being ready to help our folks in all scenarios, really.
And that's the key point. Talk to your provider is that generic statement. Don't believe everything you read online. We've known for a long time. But when we have our government coming out making a statement like that, we should be able to believe it. And unfortunately, now we have to go to your leading healthcare organizations that have really dived into the studies to find out, okay, what is really happening? And we have all of them on the same page. So I'd like to add some key takeaways from our conversation today. One is for our pregnant women and our pharmacists consulting the pregnant women, don't panic. Acetaminophen is still considered safe and first line by every major health body overseeing organization. Balance matters. Untreated fever or severe pain in pregnancy can harm both mom and baby. Best practices are used only when needed at the lowest effective dose for the shortest time. We already said consult your providers, but include your pharmacists in that, your healthcare team, of course, your OBGYNs, your midwives, and whoever you trust with your care. And there is ongoing research. Science continues to evaluate possible risks, but right now, the benefits outweigh theoretical risks. Mark, thank you so much for joining me. Is there anything you'd like to add?
My pleasure, and happy to be here and chatting with you, and hopefully reaching a lot of people out there to, to temper the room a little bit and get the correct information out there. As you mentioned at the tail end there, the benefits outweighing theoretical risks at this point, and have been, but just getting the right information out there that I hope not only healthcare professionals are listening, but also, hey, the lay public, our neighbors, our communities as well too, to really hear this from trusted healthcare professionals.
Absolutely. It has been my honor to have this conversation with you today to get the word out. And if any of our listeners found this helpful, please do share it with those people, your patients, your colleagues, so that everybody knows. Do not stop taking one Tylenol for your fever and your baby's we have this evidence to show. And let's see what happens in the future with more studies to come or more discussions on these studies that the government used to make this statement that has caused this magnificent scare in our pregnant women and their families. So please do comment and follow us, and we'd love to hear your feedback. Mark, thank you again.
You're very welcome. Hope you all have a wonderful day every day.